Thank you very much, Congressman and Speaker Gingrich. Our first speaker today is Wayne Sencer, who's the Chief Executive Officer of Allegiant Health based in Omaha. I will let Wayne do his own slides, but he is one of the most innovative CEOs in the entire country. He's pushed the envelope in many ways, and he's seen some truly spectacular results. And we're very happy to have him here today. So turn it over to you, Wayne.
Good afternoon. I appreciate all of you joining us here this afternoon, and I bring you greetings from the breadbasket of America. From Nebraska and Iowa, I represent the backbone of American medicine, independent physicians primarily, and 9 community-based hospitals. And I'm going to share you some thoughts sort of from the field, if you will, all of which is currently underway, all of which are tangible results that we've actually experienced in our journey to providing better health care to everyday Americans. You know, if I had to guess what brought each of you respectively to the room here today, I would guess there's a whole plethora of reasons, but I would hope that one of them is you all agree with me that health care indeed is not sustainable in America as we know it today. It simply is not sustainable. And whether it's 17% of GDP or 20 or 21, at some point in time there will be no more resources. And frankly, although I don't write prescriptions, Congressman Burgess, indeed, I work with a lot of great folks that do, and I think I would also have to say, nor is it effective and as efficient and as good as we would all want it today. Great variability exists in healthcare across America. And so what I'm here to talk about is a call to action, and as a provider maybe a little unique in that I'm sharing a call to action, but I think it's time for us as Americans and as leaders to step forward with courage to address some of these issues that face this delivery system before we hit the wall, which is indeed racing toward us. Now, I must start my remarks by acknowledging I wish there were a silver bullet. By the way, if there was, someone really bright like Speaker Gingrich would have found it already. And there's not a single solution. This is a very complex fabric of healthcare in this country. On the other hand, I think if we simply say there is no solution, we've really let down those that depend on us. And we're really failing our friends and our neighbors and those that depend on us, particularly those of us who are healthcare leaders and have the opportunity to influence. My brief 10 minutes with you today, I'd like to paint the construct that if there is no silver bullet, the closest thing to a silver bullet from my humble professional view is to give consumers more say in and more control over their health and their health care. And to do that, we have to undertake 3 very major shifts in the way we look at health care today. And I'd like to quickly speak to each of those shifts for you. The first is if we're going to give consumers more control and more say in their health care, we, the provider community, need to embrace and support true transparency. How do people know how good we are as providers? How do they know how good our doctors and our hospitals really are? God forbid you have a clue what we cost. What other good or service do we buy in America today that you buy without any clue how good it is or what it costs? I think it's time that we really, from the inside out, we as providers, embrace transparency and really understand and acknowledge that it's a right of Americans to know how good we are and what we cost. A quick slide here just to document our journey at Allegiant Health. As I shared with you as I began today, these are all real-life examples. 3 years ago, we began publishing our own quality scores. Took out full-page ads in all of our regional newspapers, starting with the CMS core measures. We now report 30 indicators. It's web-based as well as in print medium. And I must tell you, the first time we shared those scores, we shared the good and the bad. Yes, you heard me, the good and the bad. You want to guess what our quality scores look like today? I would stack them up against any major health system in America. Gee, go figure, as you measure, benchmark, and report, phenomenal things begin to happen. And my general public has a clue how we stack up in all of the major diagnoses. We really didn't stop there, however. I believe the other half of the value equation is equally important, and that is, what does it cost? And while that's not been terribly relevant to most Americans, I submit it will be relevant to most Americans in the future. And so in January of 2000, we brought live a web-based product we call MyCost. It has a patent pending, although we're readily sharing it with health systems across America. It allows you to model what your specific cost would be for your specific insurance plan if you have one, as well as your projected out-of-pocket cost based on your current copay and deductible. In essence, what is the cost to you, not the average cost, not the blended cost, not the Medicare cost. And since January of 2007, in spite of the fact that Omaha is not the largest city in the United States, imagine that, we've had 35,000 people go online and go through the entire calculation to determine what the cost would be for a procedure or a test at an Allegiant Health hospital or ambulatory site. Moving along, the second major change that needs to occur, and Speaker Gingrich alluded to this, and I very passionately believe, we need to connect people directly with the payment for health care services. In essence, the age-old underlying principle of let's incent Americans to do the right thing, not punish them, it never works. Let's incent Americans to take better control of their health and their health care. I was having a conversation several years ago with a local, although albeit national, CEO of a major company. And he said to me, Wayne, what are you doing with your own 9,000 employees and their dependents? And by the way, this was Dick Davidson, the then CEO of Union Pacific. What are you doing with your own employees to serve as a petri dish to get them more engaged in their health and their health care? And the answer was, we developed a consumer-driven health plan, 2 HSAs, 2 HRAs, and a traditional PPO product. We gave people a high-quality health care product that put them in charge of the dollars being spent on their behalf. And I got to tell you, some phenomenal things have occurred. 2 constructs, though, that I must speak to make sure that we have an understanding. It's not just about the high-deductible vehicle. It's about the benefit plan you wrap around the vehicle. Number 1, if you're an Allegiant Health employee or dependent, preventative care is free. You heard me, no deductible, no copay, no HSA, no HRA. Why would I not pay for annual physicals, mammographies, colonoscopies, the things we know will avoid very serious injury? At Allegiant Health, it's free. Construct number 2, applying to our consumer-driven plan, we call it Healthy Rewards, and that is we directly incentivize people to change their lifestyles. The single greatest determinant as to how much health care you will consume in your life is not heredity, it's lifestyle. And so we directly incentivize people to take control of their lifestyle or to more effectively manage their chronic health care condition, whichever is most relevant. I must tell you, in the first 2 years, we're in our 3rd year of operation of that plan, the results have been nothing short of phenomenal. I can tell you the metrics support very definitively we have a healthier workforce today than we did 2.5 years ago. You know, isn't that a great thing? Healthier workers come to work, they stay at work, they recover more readily from illness, they're happier to be at work, they have more energy, and oh, by the way, I spend less on their health care as their employer. Before I speak to the cost, though, I would say the coolest thing about our consumer-driven plan, all the above, but it's changed the dialogue that people have about their health care. It's changed the equation. I call it the water cooler effect. You walk up to the water cooler and people are talking about what are my options, what's most efficient, where can I go for X, Y, Z, what's the alternative drug to the one that's been prescribed to me. People engage meaningful in conversation as consumers of health care. And oh, by the way, over the last 2 years, our average increases, fully loaded, including our healthy rewards, all the rollout expenses, all of the preventative care, our costs have gone up a paltry 5.1% each of the last 2 years, or roughly half of what the national average has been. I want to take a quick sidetrack, though, because this is what really fires me up. I'm speaking globally about 5 different options, 4 of which are consumer-driven. Now let me speak to our 2 health savings accounts in a more granular sense, because this is where the real significant movement has occurred. And I call out these 2 particular vehicles because, from my vantage point, they are the bastion of truly consumer-driven, first dollar coming out of the pocket of the individual as opposed to the organization. We have seen monumental movement of those individuals relative to the engagement in their health care. These people are significantly more inclined to do their annual health risk appraisals, to use our online tools to look at both quality and cost. They are considerably more likely to purchase generic drugs, and get this, they are 4 times more likely to consume preventative care than the national average. Now, from my vantage point, that's the trifecta. 4 times more likely to consume preventative care than the national average. This level of engagement, folks, not only does indeed mean I've got a healthier workforce, and specifically, healthier workforce utilizing our HSAs, but of course that too has cost implications. And while our overall costs have gone up a paltry 5.1% each of the last 2 years, for our folks participating in the HSAs, it has been an incredible experience. Between 2006 and 2007, the cost of those two plans going down by 15%. Healthier workforce, more engaged workforce, costs went down by 15%. I want to quickly say I've read a lot of literature around what's going on in the country with HSAs and HRAs, and I think you can slice data a lot of different directions. Let me say very quickly, for me it's not about the two vehicles, the HSAs and the HRAs. It's about the benefit plan you wrap around those two vehicles that the government chose and the administration chose to provide to us. So it's really about the benefit plan. Here's what our experience has been relative to two of the greatest criticisms, and that is, do people put off their care? Do they really set aside for the future? I'm happy to report that as you speak to our HSAs, over 80% of our folks participating regularly contributed to their HSA. And get this statistic, 32% of my workforce now participating in HSAs have fully funded their HSA. It means that they can afford to pay their entire deductible out of what's now saved and will now have no out-of-pocket costs whatsoever. Last statistic, there is some concern that's being articulated about what about the less fortunate parts of our workforce or the lower paid parts of our workforce. People on my payroll that earn less than $25,000 a year, I'm happy to report, and participated in HSA contributed each of the last 2 years over $1,400 to their HSAs. They get it too. As I close talking about our HSAs, last couple factoids, 92% of our workforce and our dependents now participate in one of those 4 consumer-driven plans, in spite of the fact we have a traditional PPO still in place. And these are rather strange statistics, but we've lost 13,000 pounds over the last 2 years. My workforce is rather proud of that. That's an average weight loss of 15 pounds, which clinicians would indicate does have clinical significance, and over 500 people have quit smoking. I would say this as I close my notions about incentivize people to do the right thing. I think this is definitive proof that Americans, given the appropriate tools, given appropriate incentives, can and do make informed decisions about their health care, and the result is they are healthier, and ultimately it will lower costs as well. One last change is going to be necessary if we're going to ride this wave of putting the consumer in the driver's seat of health care, and that is, let's give folks more choice. Let's give folks more choice. You know, if you look at other industries in this country, there are very few industries that would be willing to say you can have it our way but not your way. And to borrow a line from some fast food chain a number of years ago, 1974 to be exact, when they first said you can have it your way, does that apply to health care? Does that apply to health care? Do we have choices of appropriate access that are efficient, that are really convenient for individuals? And I think largely the answer to that is perhaps maybe not so. At Allegiant Health, we have an entire retail strategy aimed at giving people what they're asking for and what they're choosing to pay for. That retail strategy includes things like walk-in clinics in grocery stores, a huge hit in the greater Omaha area. 7 we're currently operating. It includes things like sleep stores. It includes things like true retail pharmacies operated by hospitals, and a plethora of additional retail products soon coming to a community near you. Give people what they really want. I'm going to close as I've consumed my 12 and a half minutes or so by saying that I really believe that if we in this industry were to look outside of this industry at any other industry that has put consumers in charge, very obvious things occur, and they'll occur in healthcare too. And that is, there will be a birth of new products, of new services, new conveniences that respond to what people really want. There will be higher quality services and products, and oh, by the way, it will drive efficiency and cost downward. Why should healthcare be any different? I believe it is indeed time for a change in this industry. I believe we can no longer afford to let Americans sit on the sidelines of their health care and have it be something that is done to them. Rather, it must be a partnership that is done with them. Our health care system is oh so clearly broken. and the solutions, I believe, are lying within our grasp in the petri dishes across this country, like Allegiant Health. The solution, I would close, is not for healthcare decisions to be made on Americans' behalf for them. I believe the solution is to have the courage to put Americans in control of their health care, give them tools, give them incentives, and give them access points so they can be truly engaged in their health and their health care. Thank you very much.